think at 6 o'clock, the Board of Health meeting of 4/19/2023 is in order. First on the agenda, review and sign the minutes of March 2023 Board of Health meeting and approve correction to the typo in February 2023 minutes.
Okay, here are the minutes. I'm assuming everybody got a chance to review.
I think we all reviewed.
Yes.
Is there a motion?
I make a motion to approve the March Board of Health minutes.
Seconded.
All in favor?
Aye.
And I need a motion to approve the correction of the typo in the February 2023 minutes.
I move to correct the, to approve the correction of the typo in the February minutes.
I second it.
All in favor?
Aye.
Aye. Okay. Well, I am incredibly pleased, actually, I'm both sad and pleased. I am sad that this is Maggie's last meeting, and we were very fortunate in being able to give her a good goodbye in the last hour.
Yes, thank you.
And I am happy to announce that we have a wonderful new assistant, Jessica Pritchard. Did I say that name correctly?
You said it just fine,
Okay.
yeah.
And Jess, do you go by Jess or
I
Jessica?
certainly can, Jess or Jessica, yeah.
Okay. Maybe would you want to say a few words?
Sure. So, hello everyone, my name is Jessica Pritchard. I have a background in customer service administration. I currently hold an associate's degree with a concentration in English and psychology. I did graduate with honors. And I'm very happy to be on board with you all, and thank you for the opportunity, the town here in West Boylston. So thanks. We're glad
Welcome.
you're here.
Thank you. We're very pleased to have you. COVID-19 updates. So I think we're in a stable position right now. The sewage RNA levels are running at 200 to 300 copies per mil. The UMass system, along with St. B's, is the total number of individuals in the hospital who are testing positive is running 30 to 40 on a daily basis. As I mentioned before, these just indicate people who come into the hospital who happen to test positive for COVID. So if someone comes in and they've got an upper respiratory infection, they get tested and they turn out positive, that goes into those statistics. So the majority of those individuals, that is 30 to 40 a day, are individuals who are hospitalized because of other reasons, not because of COVID. If one looks at the sequencing that is coming out of the Blackstone Valley, it is the XBB variant, which is now 99%, and that's the variant that basically covers most of the United States. So, and that's been present for a significant period of time. And at this point, I know of no new variants that are galloping along. So, like I said, we're in a stable position. And I think the last thing I would mention is that folks have probably heard in the last few days about the FDA approving individuals over 65 years of age or those who are immunosuppressed are able to get another booster with the bivalent vaccine. Does that mean that everybody should run out and get the bivalent booster? I think most of the scientists who work in this area that I know would recommend that people who are fully immunized, including having one booster, that there's no reason to get another booster unless you're in a high-risk situation, immunosuppressed, or you have underlying medical conditions which would cause you to have more severe infections with COVID. If you are in one of those categories, then it's probably reasonable to take advantage of the booster. Any other comments? Hearing none. our regional health updates. Solo?
Thank you. Good evening, everyone. And Jessica, welcome.
Thank you.
So, Mecca is on vacation today. And so, prior to him leaving, he and I met, and I wanted to give an update in terms of his inspection he did from March 20th to April 19th. He did 15 routine inspections, 2 mobile food inspections, 2 body art inspections, and he received 6 complaints. So far, his work has been great. I meet with Mecca every other week to discuss his challenge and ways that we can support his work. So,
Great.
Any questions?
What were the complaints?
So trash at the Centerwood Terrace, dog-related, sanitation at Freedom Village apartment, cannabis outdoor investigation, roasted noise, Temple Street, food labeling complaint at West Boylston Street, and food worker personal cleanliness at West Boylston Street. So,
I think they resolved the
yes.
The cannabis?
the cannabis.
Yes.
Yes,
Yes, it was resolved. He went over just to check on it
yeah,
Okay,
so,
because you wanted it reported.
yes.
But by the time we got it all reported, the building inspector had already given them a directive and an ongoing directive
Right.
for keeping track of everything.
Yeah, I got some calls to my house with regard to the odor from the processing. And I came to the office and I asked that the person that reported to me file a complaint, so it's documented. And we, as I understand it, the zoning officer is responsible for the marijuana complaints
Yes.
regarding smells, and the zoning officer is the building inspector. So George went out and he followed up on that, and I was concerned because it was a nuisance, and so, but it's been resolved, that's good. And the rooster was resolved as well.
I haven't heard from the complainant about the rooster yet.
yes, so he just said he visited one, so it has not been resolved yet, so.
Right, because the person who owns the rooster was not home at the
Yes.
time, so he may go back, but I'm gonna get back in touch with, although the person wanted to remain anonymous to his neighbor, I have this information, so I can at least give him a call and see what's going on, but we sent out a letter.
Okay.
To them.
What was the street that was on, do you
It's
know?
on Shrewsbury Street, it's down here somewhere.
I know, okay.
And basically, just made recommendation for the rooster collar
Right.
as an option, that, because, and I also let Jessica, just on the same note, I let Jessica know that we never completed with the agricultural committee the new regulations for them. That's got kind of put on hold during the pandemic.
Right.
So that's something that is gonna have to be completed. It was almost done, but
Yeah.
it's gonna
Well,
have to
we
be
can
completed.
Take that up at a future meeting.
Yes.
Solo, thank you.
You're welcome.
Do you have other issues?
Well, I just want to provide an update. Next week, Wednesday, I'll be meeting with the chair of this board and the town administrator to discuss the new IMAs in Shrewsbury. That meeting will be from 10 o'clock, 10:30 to 12:30.
That's next Wednesday,
Next
right?
Wednesday, yes.
Yeah, I think I said I
Yes,
would
yeah,
attend,
you
but,
attend,
yeah.
yes. Thank you for attending.
Any other questions or comments? Tom, do you want to give us our
I don't have a
update?
new update because I didn't attend the meeting, and I haven't got the minutes yet, so.
So I attended the meeting, Tom. We are in the process of hiring a new emergency preparedness grant writer. She will be starting May 1st, and that individual will help enhance our capacity. Shane Wagner, who was the preparedness grant manager, left to work for the state, so we have him, we just replacing. And I person will definitely enhance our capacity. At the last meeting, we discussed the new FEP deliverables and some of the funding
Right.
opportunities. And so we do have some money to spend, and I think Ms. Alicia will be in contact with you regarding your options, because I know the town is interested in purchasing additional items to enhance the capacity
Okay.
as well.
That trailer still needs to get repaired.
Yes, so I just met with my colleague prior to coming to this meeting. The consultant will be out in a week or two
Okay.
to repair the tires. So if you need additional information, she and I will be coming to see the trailer as well.
Okay.
And that's Alyssa Reed,
Yeah,
right?
Alyssa, yes.
Okay.
Alyssa Reed.
I just wanted to double
Yes.
check and make sure I had the name right
So-
for,
So it needs new tires, is
Yes,
what-
it
okay.
needs new tires, so
Okay.
I and Lisa will be coming out. And I believe, Maggie, you and Lisa and the police chief, the fire chief are on some email regarding the process as well? It was a while back ago?
a while back, but I don't remember exactly, what happened with that. But I know that there was, I believe that she was gonna contact the fire chief about,
Yes, yeah,
going over to take care of the trailer.
The trailer,
I
yes.
think so.
yes, so,
Maybe I can follow up and just, let him know, or let them both send an email out tomorrow, so that they are aware that that's going forward, or
Yes, yes.
Alyssa will contact the fire chief?
well, once the consultant come out, Lisa will let the fire chief know that.
Okay,
he's
well then
coming.
they don't need to, I don't need to do anything then. No, okay, great.
Yes,
All right, she has his information. All
Come
right,
Yeah.
all right.
Then we talked about garage in the trailer,
Yes,
and Maggie worked with, put out an email about that, and evidently, there's a possibility that we might be able to house it in a new, power company's, the electric company's new garage. So, I also talked to, Mr. Fitch.
yes, John
Is that
Fitch.
what's being built on Central Street?
Yes.
That's, yeah, it's gonna be a good-sized garage. He's got a garage,
Good
his
location.
trucks, yeah,
Right.
yeah.
Yep, they have a new garage for their vehicles, and he thought there might have a space for the trailer, which would be
Yeah.
great.
Yeah.
So it's protected.
Okay. Other comments? You good, Tom?
Yep.
Office report.
Okay. Just so that you guys can see, I'm gonna pass around the latest disease count for COVID. We're down to 5 cases, this most recent invoice, so that's great. Let's see. We also, let me find my cheat sheet here. Figures I can't, oh, here it is right here. There's still nothing going on at that Lancaster Street property where Pickoff Properties was going to rebuild a house. It's just, I don't think his permits are even valid anymore, but I haven't heard anything. There's 3 active projects that are gonna be going on this spring for septic system replacements. 13 Winthrop Street, Mercurio and Sons is gonna be doing that. They're gonna be starting everything, spring is the season to start these things. So 33 Prescott Street, Baldarelli and Sons is gonna be doing that project. And 114 Lee Street, which was the home that I said was sold with a failed system, they've sold it, and the owner has paid for their disposal system construction permit fees and for the soil test application fee. And Mercurio and Sons is also gonna be doing that project. He did the inspection, and so I passed his name on to the person that was interested in the property, so at least they could get some background, and they ended up, deciding to hire them. He was the one that did the Title V, so the person wanted to know more about that, so he contacted Dan. We had one Title V inspection. There was at 21 Winthrop, it was conditionally passed with repaired components, which were done, and we received the certificate of compliance for that. We have some sort of limbo situations, which I emailed Phil about, and I've talked about it before. 104 Shrine, which is the apartment building that had their, that were hooked up to sewer back in, I can't even remember, I don't even have the date here as to what year, but it was some time ago, it's a number of years ago. They were hooked up to the sewer, but I could not find anything that referred to the abandonment of the existing tank that was there for that building. When I talked to DPW, they had a note that the installer, that the person who hooked them up to sewer did not abandon the tank because they thought it had, it was also used for an adjacent, a nearby apartment building, which is built exactly like this one. I found this out when the new apartment building was finally hooked up to sewer. They were half hooked up and they got fully hooked up when they were bought by the same company that owns the other apartment building. The guy told me that they would do an exploratory to see what the situation was with the tank at the other building. They never did it. And I've sent 2 letters. Phil told me to send a second letter and give them a 2-week notice for a plan to explore the situation, to see what was going on. So I informed Phil today that I have not received, they did receive the letter, but they have not done anything about a plan to explore and see whether that tank has been abandoned properly. I explained the situation to Jessica so she knows what's going on. I think I have an email from Phil, and he said he would follow up. All right, so now the other situation is the 242 Fairbank Street. This is a man who came in who had he suspected a failed system, but he never got a Title V done. And so he decided on his own to try to get it resolved through this prana system, which is actually not allowed in our state, but the contractor didn't tell him that, so it didn't work. And so he got most of his, this has gone back since 2020. So 2020 is when he reported it to me. In the meantime, he went and got this prana system on his own. The attempt to resolve the problem failed, and he asked for his neighbor is Dan Mercurio, so he asked Dan as a neighbor to come and look at it. Dan told me verbally the system has failed. This is a long story, I guess. But there's been no official Title V done. So I got back to the guy because he told me that he was going to talk to Dan about doing a replacement system. He also inquired about the funding that we had, because he knew from somebody in town about that funding that we used to have to help people. It never paid for a full replacement, but it provided some financial help when people had to get their system replaced and they couldn't get a full loan. But that was before the interest rate, that was when the interest rates were high, and they've gone down, and so the interest rates the banks have now are very comparable to what that funding source was for. And I have no idea, I have no clue as to how to access that or what to do with it anyway. So I let Jessica know about that just so she's aware. I let Jennifer also know that funding is there. There's everybody who borrowed from it in the past has paid it back. I don't know there is a discrepancy between what we were given by the state and what is, back in the account, but I don't know enough about it.
Who takes care of that fund?
I don't know.
You don't know in this building who's in charge of it?
Must be the town accountant.
Huh?
Town accountant.
Well, she doesn't know anything about it either, because she wasn't here when we got it. So it's
Who's on first, right?
yes, it's one of those situations, and I can't find enough about it. Apparently, I thought there was missing money because they had hired a company to oversee the process of getting people involved, but I don't know if that's true. I don't have enough information. I don't have any paperwork on it.
Well, I think what I would suggest that you do is refer him to the town administrator and let her sort it out.
Well, I
Since
basically,
we're not in charge of that.
well, I think we were involved in it, but I don't know how. I just don't know, and I let her know about it.
But we don't have we don't have access to those funds
No.
or make the decision, so make the referral to the town administrator.
All right, well, I just want to let me finish telling you what happened. So I didn't hear from him after, I sent him a letter because I hadn't heard anything about what he was planning to do. And when he called me after he got the letter, he said that he thought that they no longer thinks the system is in failure, because he doesn't want to deal with that, I guess. But Dan told me, yes, the system's in failure, but there's no, I don't really know what to do at this point, whether there's some kind of a way to order him to get a Title V, or what is involved with that.
Well, you gotta get a hold of Phil Agier.
I did already. Phil
and
had
Phil-
me sent the letter.
Okay, now Phil has to take control
Yes,
of the
so I let him
situation.
know about what happened, and I'll let him go from there.
Phil will take care of it.
Okay, that's what I thought. The other, 53 Central Street, I have to check on, I plan to check on it before I go, just to see what the status is. That was the one that never connected to sewer, and I don't know what the foreclosure status is anymore. I haven't checked in a while. They was under foreclosure, and they let people, in a couple of situations, like with Dr. Tajin, they let them stay in their homes even though they were living there under foreclosure because of COVID.
But there's nobody living in that house,
53 Central?
Yes, there is,
is there?
yeah. The other property you're thinking about is the
The
next
two,
one,
oh, it's,
45 and 49 were purchased, and they hooked up to sewer.
and no one's there.
No, and no one's living there
Yeah,
yet.
that's right.
they're hooked up?
Yes,
Yeah,
they did
that
get hooked up.
property is hooked up.
The two, 45 and 49 and 53 were all owned by the same person. They were all foreclosed on. The foreclosed properties at 45 and 49 were purchased, and the owners that bought it got the sewer hookup. It's only 53 over there that's left that's not hooked up to sewer.
Is it
Oh,
possible that when
And that's the one
all
that's
COVID
occupied.
rules and regulations end on May, whatever,
I
that
have no idea at this point. Dr. Tajin ended up having to go into a nursing home, and finally the owner, the person who actually bought it while it was, that's a different situation, but somebody actually bought the property and had to let him stay there, even though they purchased it before COVID, because COVID came in and they couldn't make him move. But he's in a nursing home now, so I don't know what the situation will be with 53 Central. I mean, at this point, I have no idea.
Well, who decides that?
I guess the banks, maybe, they have to decide. And so, just so you know, if somebody does buy it, they will be required to hook up to sewer. It's a mandated thing, it's that.
While it's in foreclosure, this was many years ago, I was told by town council that there was no sense in pursuing
Right.
and to hook up. So if it's still in foreclosure, then we
As long as
actually,
people are in present.
yeah, well, we actually spent over $10,000 trying to hook up those properties through court actions that we took as the Board of Health at that time. And once he went into foreclosure, we abandoned our effort.
So,
That's where we stand with it.
So I have to check on the status of that. I really don't know. It kind of looks empty, but I'm not sure. Anyway, so permits and fees, there's been 135 approved for 2023 to date. There's 3 kind of in pending. Micah is following up with Heritage Rose. They have a person who's a piercer. She's actually a nurse who does piercing as well, and she's gonna do it, she's gonna be there part-time. And there was she was having some trouble finding her vaccination information, so he's gonna follow up with her. We know she's vaccinated, but because she's been an LPN for so long, I guess, it was hard for her to get the paperwork on it. Camp Woodhaven has got their paperwork in, and that's being reviewed. Mike is taking care of that. And Sterling Meadows, we just received their pool application for the season, but we haven't gotten all the paperwork in, so that's not complete. And Micah is also going to follow up with a Lubella. This is somebody who has three businesses over at the plaza where Dunkin' Donuts is. And she has said that she's decided not to do the microblading. She uses the the store as an office, but she had wanted to get her permits so she could put them on the wall to look official. But she's missing paperwork, so she's gonna have a deadline at the end of June, that if she doesn't get in her paperwork, before then, or decide that she doesn't want the permits, then, they will just be null and void at that point, by the end of the fiscal year, yeah. So that's sort of the deadline that, was given to me by, Faye. She said that's what she uses. If people don't get all their paperwork in, by then they will, basically lose their money. She can get her money back if she says, okay, I'm not gonna do it, but she wouldn't respond to any of my emails or calls, so. There is, the tobacco issues. Cherry is going to be following up with Choice Smoke Shop. She believes he had decided to continue carrying the lottery and no longer be an adult-only store, so she's gonna go over what's required of him in that transition. We had, the bill approvals that we had, everything's signed so far. We have, the bill for COVID from, nursing services, and we have the bill for nursing services from January through March for the other, disease reporting, monitoring. We have a Worcester DPH, February IMA invoice. And we finally got through the 2022 Title V invoice, which I worked together with the folks from Worcester to put together, because Julie had never, given me an invoice. So we had to do a lot of research, and I worked with them to get that squared away. And there was one or two or three postal reimbursements for me when I had to do the certified mail. So that's that. Let's see, anything else? I think that covers it. So, the financial report, that out. And I'll let you look at it. There's really nothing significant, no significant change.
We're in the black still, right?
Yes, we're good. So I'll just read to you the email that I got from Leslie. She said, previously I provided the general fund budget expense summary for the $9,000 in the town budget. We've expended that in full, and the wages, as usual, that takes care of the first part of my wages for the year. They're now coming out of the Board of Health revolving account. She said nothing in that respect has changed from last month's report. So she attached the trial balance for the revolving fund and the ARPA grant account for COVID response monitoring costs, which she said were fully expended. The fund balance for the revolving fund reflects expenses payroll expended through April 18th and revenues through February 28th. And she's journalized expenses from the revolving fund to the second ARPA appropriation account of the $100,000 as of 3/31/23 to coincide with the reporting she has to do for the federal government. The reclass to ARPA grant increases the revolving fund balance. So she said the third report is the account summary for the ARPA grant funds for the Worcester Alliance costs. So right now is the ARPA grant funds is what we use to pay for the IMAs. So I think that will continue. But they're here, you can pass them around, look at them. And I'm thankful that she started sending this to me, because it used to be a lot simpler when we didn't have all these grants and funds and how they're split up, and this has to be used for this and this has to be used for that. I got a little lost, but that will continue to we'll continue to do that. And I think that we are all set. The other thing was there was something. Oh, the tobacco regulations, smoking regulations. Once Cherry gets me Worcester's smoking regulations, we can deal with that. But we found out, somebody had called about smoking regulations, and ours are from 2000, and they need to be updated to include cannabis. in
Right,
the
I said
regulations.
when we get something, then we can
Yes,
deal
then
with
we
it.
can look at it and review it, so I just wanted to make that clear, that I'd followed up on that, and that'll be coming. That's it, so you guys, can decide when the next meeting is?
Yeah, I'm just looking
May
at my
10?
calendar.
There's 10th, 17th, and 24th, second,
Right.
third.
Second would be May 10th. So why don't we, unless anybody here knows they're not here on May 10th, then let's,
We do May
Maggie,
10th,
send out an email, or Jessica, for May 10th is our next meeting.
So that's what's proposed, and once she gets confirmation, she'll take it to Damien and have it scheduled in the town calendar.
I have a question, Mr. Chairman. How much are we budgeted for in this coming budget year? Has anybody seen that number yet, or at all?
No?
Has
anybody talked to the Board of Health about that at all?
And I'm not sure
The
what you're
budget
referring
that's
to.
gonna be effective for next July.
That's what I think they're deciding, was the proposal for the $42,000.
Well, our tax levy is typically $9,000. Are we still in there for that amount of money, or
I
do we
think,
know?
I think probably Jess should see from Jen, what the draft budget shows for the Board of Health. I think, so we don't have information on that at this point, right?
Right.
Right.
So why
So I'm
don't
gonna
we?
put that on the agenda for next time.
Yeah,
Okay.
yeah, I think, let's get the information and then we can have a discussion.
And you're
Does that
gonna be
sound
going to the
reasonable?
meeting with,
Pardon?
you're gonna be going to the meeting about the,
Yeah, but that has not, that's not related to the town budget.
oh, the town budget.
Town budget, you're talking about town budget.
You're talking about the
That's
correct. The
$9,000
tax levy,
they
that's right.
contribute,
Right.
or whether it will continue or
So
not?
we need to know what the expectation for the town is gonna give us.
Right, I don't know how they're gonna work it out with the change in the administrative assistant
Yeah, that's what
position.
I'm saying. Jess
Yeah.
can figure that all out, so, and we can have that as an agenda item for the next meeting.
Okay, sounds good.
So let's shoot for May 10th, and everybody can reply to the email. Any other new business?
That's gonna be a busy week. Town meeting is
I don't know.
the 15th,
I think you're right.
yeah, and then we've got,
Right, it's the 15th.
I believe so.
right,
So just so you're aware, Jen has asked that Jessica, I'm gonna be here for the next 2 days. Jessica's gonna start taking taking calls and this and that, and I'll sort of be there to sort of, help her with
Right.
the process of the changeover. We've covered a good portion of the things in the office, but I'm gonna give her my phone number, and I'll be available if anything comes up that she has questions about.
Good.
I have a question. If you're out of the office, Jessica, is there someone gonna cover for you for that day if you were, say you're out sick or something?
Sure, I'm not sure what the plan is for
Yeah,
that just
I'm
yet.
a little concerned about that,
Yeah, I'll
Why?
touch base with Jen.
because the office will be closed. There'll be nobody to take the phone calls.
Who takes calls when Maggie's not there?
Well, they usually, if Cheryl, the building inspector, there'd be someone present in the office.
Well, there is somebody that's gonna be present in the office till
For the time being.
when?
I believe the end of June,
Yeah.
Cheryl will be.
Right, and then after
So-
that, I
So
just
we have
curious.
time to figure that out, right?
Okay, we need to figure that out.
I think we can do that.
Okay.
Jez will be all over that.
I'll put it on the list of things to do.
Okay.
Motion to adjourn?
I make a motion to adjourn.
Seconded.
All in favor?
Aye.